Good afternoon, everyone. Welcome to the Committee on Finance. Today is Thursday, March 30th at 2 p.m. We're in conference room 308, and we're going to get started on this agenda. So the first agenda item is SB 7 HD1. This is relating to the School Facilities Authority. So first up to testify, we have Keone Farias.
Mahalo, Vice Chair, members of the committee, Chad Keone Farias, School Facilities Authority, stand on our written testimony. Available for questions. Thank you.
That is the only testifier on this measure. Is there anyone else wishing to testify? Okay, seeing none, committee members, any questions for Mr. Farias? Okay, seeing none, we're going to move to our next agenda item, SB 531 SD2 HD1. This is relating to education. First up, we have the Attorney General's office.
Good afternoon, Vice Chair Kitagawa, members of the committee, and Horiuchi from the Department of the Attorney General. Just to summarize our testimony, we have some suggestions regarding where this should be properly placed in terms of being in a different section of the SFA statute in order to implement the intention of the bill. So I will, it's in our testimony, I think it's best just stated there, but I'm available for questions. Thank you.
Thank you very much. That is the only person indicated they want to testify on this measure. Is there anyone else wishing to testify? Okay, seeing none, committee members, any questions? Okay, seeing none, we're going to go to our next agenda item, SB 107 SD1 HD1. This is relating to the Board of Education. First up to testify, we have the Board of Education.
Good afternoon, Vice Chair and members of the committee. Bruce Voss, Chair of the Board of Education. We stand on a written testimony offering comments and available for any questions. Thank you.
Thank you very much. Is there anyone else wishing to testify on this measure? Okay, seeing none, committee members, any questions? Okay, seeing none, we're going to move to our next agenda item, SB 156 SD1 HD1. This is also relating to the Board of Education. First up is the Board of Education.
Wish I could just say ditto, Vice Chair. Good afternoon again. Bruce Voss, Chair of the Board of Ed. Stand on a written testimony offering comments available for questions. Thank you.
Thank you very much. Anyone else wishing to testify on this measure? Okay, seeing none, committee members, any questions? Okay, seeing none, we're going to go to our next item, SB 1022 HD1. This is relating to the Early Learning Board. First up to testify, we have the Early Learning Board.
Good afternoon, Vice Chair and members of the committee. The Early Learning Board stands on its testimony as submitted and is available to answer any questions from the committee. Thank you.
Thank you very much. Next, we have the Attorney General.
Good afternoon, Vice Chair Kitagawa, members, and Horiuchi from the Department of the Attorney General. As we noted in our testimony, there's drafting errors in the current version of the bill. So in our testimony, we've laid out how we think that the drafting error can be corrected in order to implement the intention of the bill. I'll be available for questions. Thank you.
Thank you very much. Is there anyone else wishing to testify on this measure? Okay, seeing none, committee members, questions? Okay, seeing none, we're going to go to our next measure, which is SB 1232 SD1 HD1. This is relating to the state library system. First up, we have the state library system.
Aloha and good afternoon, Vice Chair and members of the committee. We stand on our written testimony in support of Senate Bill 1232, and I'm available for any questions that you may have. Thank you.
Thank you very much. Is there anyone else wishing to testify on this measure? Okay, seeing none, committee members, questions? Yes, Representative Ward.
Thank you, Chair. The librarian, what kind of fees and fines do you have in mind? Do you have something that we can know what it's, and then how much would they be, for example?
Sure. So we only charge for enhanced services, so that we're not looking at anything that is a standard service that the library would offer. So right now we charge for DVDs, or we charge for people who don't live in Hawaii, we charge for library cards. What we're looking at are enhanced services, like one of the things we're looking at are batteries that people could check out and take home if they didn't have power. They could charge up their devices, their computers, and there would be a small fee attached to that. And I don't have the exact fee, but it wouldn't be a large amount.
How about fines? Maybe I took this as a bit in the negative rather than the
Oh.
positive. What are the fines that you have now?
They're very minimal. It's 25 cents a day for late overdue and nothing over $7 for any one single item. So they're very minimal at this time. And we really I don't think right now we would be looking at fees. We're actually looking at enhancing services to offer more opportunities and to be able to use that money to continue to support that new service that we're trying to develop.
One of the best deals in town. Thank you for all that you do.
Thank you, sir.
Thank you very much. Any additional questions? Yes, Representative Kobayashi.
For State Library, do these changes in fees, waivers, etc., have to go to the Board of Education?
They would, with this bill, yes, they would. Currently, for us to make any kind of changes or to put any fees forth, we have to go through a whole process to go through the admin rule change process, which has to go through the board, it has to go through the lieutenant governor, and it has to go through the legislature.
But here you're you're deleting the Chapter 91
And we're asking to go through the board.
directly to the board.
Yes, sir.
Okay. Do you have a advisory committee other than the Board of Education?
The board is our direct support.
Okay,
Mhm.
thank you.
Thank you.
Okay, thank you very much. Any additional questions? Okay, seeing none, we're going to go to our next item, SB 971, SD2, HD1. This is relating to student transportation. First up to testify, we have the Attorney General.
Good afternoon, Vice Chair Kitagawa, members, and Horiuchi from the Department of the Attorney General. As set forth in our testimony, I think it's our understanding that the bill is meant to apply to high school students, and for that reason, there needs to be, or we are recommending revisions to ensure that it's clear that the bill applies not only to public high school, department high school students, but also to charter high school students rather than all charter school students, which is how the bill currently reads. And there are other recommendations that we have in our testimony. However, it is my understanding that the DOE and the Commission may be working on this issue on their own in terms of the data collection and appropriations. And so I would defer to them on what might be happening with regard to the other points raised in our testimony. I'm available for questions. Thank you.
Thank you very much. Next up, the Department of Education.
Hello, Vice Chair Kitagawa, members of the committee, Randy Tanaka, Department of Education, Office of Facilities and Operations. We are in support and stand by our testimony. We are, in fact, in discussions with the charter schools now to get a better evaluation on what it'll take to do this, but we're in line with this. Thank you very much. Hello.
Thank you very much. Next is the State Public Charter School Commission.
Aloha, Vice Chair and committee members. PJ4 on behalf of Yvonne Lau. We stand in support of we stand in our submitted written testimony in support of this, and we are currently working with the DOE and look forward to working with them and our public charter schools to help serve our students.
Thank you very much. Is there anyone else wishing to testify on this measure? Okay, sure, go ahead.
Aloha, Angela Melody Young, testifying on behalf of CARES in strong support. So the city's transit vehicles on Oahu in 2021 provided for 330 million people, or about 120,000 each day as of the third quarter of 2022. And as of 2022, its fleet comprised of 508 transit vehicles and 207 paratransit vehicles, providing transit for 103 routes. And it is managed by the nonprofit Oahu Transit Services, Inc., which operates the system from from a public-private partnership with the city, the city's DTS. So this information could be helpful to DOE and the legislature because it seems like it does have the capacity to help high school and charter schools. So thank you for the opportunity to testify.
Okay, thank you. Anyone else wishing to testify? Okay, seeing none, committee members, questions? Yes, Representative
Thank
Ward.
you, Chair. AG, please. In your revisions or amendments, I just want to be clear, will it now read that all students, public schools, charter schools are covered or
No,
not?
currently as the bill reads, it's applicable to department high school students, but it says charter school students. So as we read it, that means all charter school students K through high school. And my understanding from reading the bill is that it's meant to apply to high school students. So our recommendation is to make it clear in the bill that it's referring to department high school students and charter high school students.
So that means all students would be covered.
No, just high school students,
What-
charter, or whether it's department high schools and charter high schools. Right now, this would apply to only DOE or department high school students, but to all charter school students K through 12.
But all charter schools are DOE schools,
Yes,
basically.
but the bill makes a distinction between what's under 302A and then what's under 302D, 302D being applicable to charter schools.
Okay, thank you. Now, Chair, I have to ask the DOE a question. Randy, then everybody's covered or not?
From 9th to 12th,
And
ninth
they're-
grade to 12th.
They can be charter, public, whatever.
That's correct.
Terrific, thank
Yeah,
you.
thank you.
Okay, thank you very much. Any other questions? Okay, seeing none, we're going to go to our next agenda item, SB 830 SD2 HD1. This is relating to emergency medical response. First up to testify, we have the Attorney General.
Good afternoon, Vice Chair and members. Ann Horichi from the Department of the Attorney General. As we noted in our testimony, there is the possibility that the critical emergency response team members could be subject to civil lawsuits seeking damages or criminal charges. For that reason, we have suggested adding the some language that would be added to both chapters 302A and 302D that would address the potential liability of the emergency response team members. I'm available for questions. Thank you.
Thank you very much. Next up, Department of Education.
Good afternoon, Vice Chair, members of the committee. Kurt Otaguro, Deputy Superintendent, testifying on behalf of our Superintendent Keith Hayashi. Department stands in its written testimony. We support the intent. This is an important measure, as you can well imagine, with regard to first aid, emergency response. We do appreciate the Attorney General offering some additional amendments to the bill, which we support. And just so that you understand, the funding that we're asking for is really to help solidify equipment that's needed in the schools, whether it's AD equipment, first aid kits, even mannequins as we go through a CPR training. And so the funding for the bill would be important as well. Happy to answer any questions. Thank you.
Thank you very much. Next up, we have Amanda Lunning.
Good afternoon, Vice Chair and Committee. My name is Amanda Luning. As many of you know, I'm the parent that prompted this legislation after an incident with my son. I do stand on my written testimony, and I hope that what you folks have read is sufficient. I just want to speak to what Representative Kobayashi had brought up in the last hearing that when we were with you folks around the necessity for some specificity related to the minutes matter piece. And again, as it says in our testimony, we're working actively with the Representative Woodson and the department. And so I just want to say thank you. Appreciate it.
Thank you very much. Is there anyone else wishing to testify on this measure? Okay, go ahead.
Angela Melody Young, testifying on behalf of CARES and strong support. In a medical emergency, every minute matters. Many schools conduct a variety of drills to assess coordination. The school's crisis management functions and tabletop exercises are also conducted and coordinated so that the emergency response team can improve in practice. The research from the legislature as provided by this measure finds that DOE has basic emergency response guidance. There's a gap between the training being provided and the carrying out of the training and preparedness from the staff and personnel during emergencies. Although they are trained, but they're not prepared to respond. The purpose of this act is to supplement the DOE's emergency procedures to help improve responses to emergencies, and each school shall develop a known, practiced, and maintained communication method to activate during an emergency response with their critical emergency team members. Each member shall respond in good faith when activated. On the U.S. Department of Education's directory, there are emergency documents from other schools, such as schools from California that have a very similar structure to this. And then we also see at the city, they've got a new Department of Emergency, and it was, before it was the Citizens Advisory for Civil Defense. So there are emergency teams being convened in various capacities. Especially for our schools, it is imperative to support our schools' emergency response teams so that our students can receive medical care in a timely manner. Thank you for the opportunity to testify.
Thank you. Anyone else wishing to testify on this measure? Okay, seeing none, committee members, any questions? Yes, Representative Kobayashi.
For DOE, do all schools currently have a first aid response team or member?
Do they have a team today? Yes.
A
Yes.
first aid?
They have people that are trained in the schools to deal with first aid. That's correct, whether it's in the academic side or the athletic complex side.
So with this addition, both critical emergency response and non-critical, non-emergency response would be available in all schools, charter and non-charter.
For regular schools or DOE schools, the answer is yes. For charter schools, we would hope that we would incorporate the same factors, but I can't speak for the charter schools unless the bill specifies that.
So you have a response team or response members for non-critical, non-emergency situations in
Each-
all schools.
Yes, each school will manage their emergencies and non-emergencies in a different way, whether elementary, middle, or high school. So the bill is actually supplementing and enforcing or creating more awareness of what is being done today, and that's what our testimony specified. But it's a good bill because it puts emphasis on the importance of it, and hopefully there'll be funding so that we can help the schools to execute on some of those things.
No, I just wanted to make sure that you cover the full spectrum of, shall we say, emergencies. Thank you.
Thank you.
Okay, thank you very much. Yes, Representative Ward.
Chair, DOE, please, exact follow-up to the full spectrum of coverage. The bill mentions the first aid response has defibrillator, that word?
AD. Blueberry.
But my concern is, and given what's going on now is kind of a national opiate epidemic, is Narcan something that you have in the DOE first aid kits, or something you will be getting, because it seems like it may be necessary?
Thanks for that question. You're absolutely right. It's necessary. We don't have it in there today. We're in discussions with a third-party consultant to assess what it would take to administer that. My understanding right now as we spoke, it's fairly easy.
It's a shot in the nose,
Yeah.
evidently. That
And
keeps their
so under the
breathing.
Good Samaritan law, and the key to administering that is to recognize what the symptoms are. And as long as we can train whoever's there to identify those symptoms and then take action, because somebody said earlier, seconds matter, that's what we're
Yeah.
going to be working towards.
Generally, it's blue lips and discoloration of fingers, et cetera. But should this be in the bill or in the committee report? Because I think it's important enough where it just doesn't disappear after the hearing.
That's a good question. You know, we're talking about what is mandatory for a a faculty member or even a student to react. And we saw some live cases on the highway recently that people just take action based on prior training. So absolutely, we want to create a program for CPR, not just at the teacher level, for the student level, but create it in a way that makes it aware. Same thing with AED, that probably is more adult-driven. So Narcan is something that we haven't come to the conclusion whether it should be mandatory or not. But those are the discussions that we're having as we speak.
In my opinion, it should be, and I think it's coming at the federal level to be even at bars and other places of generally recreational drugs. And not that the kids are going to be in recreational drugs, but some of them may, because of various social, economic, and other circumstances, need that. And when their breathing stops, this is it's a quicker lifesaver. Evidently, in 1 or 2 minutes, you can bring somebody right out of an opiate coma.
I don't disagree with you.
So I'd highly recommend that you guys do that.
Okay.
Thank you very much. Thank you, Chair.
Thank you. Any additional questions? Okay, seeing none, we're going to go to our next agenda item, SB 1586, SD1, HD1. This is relating to the University of Hawaii College of Tropical Agriculture and Human Resources. First up is the University of Hawaii.
Aloha Chair, Vice Chair, rest of the Finance Committee. My name is Ania Wieczorek and I'm the Interim Dean for College of Tropical Agriculture and Human Resources. Thank you so much for providing me this opportunity to testify on this bill. This is extremely important bill, not only to CETA as such, but for our stakeholders. As you know, University of Hawaii is a land-grant university, and CETA is the college that actually carries that land-grant mission. And as a land-grant college, we have 3 separate missions. First, instruction, just like rest of the university. Second, research, just like rest of the university. But then we have that 3rd mission, which is extension. And extension is basically taking the knowledge that was gained by our researchers and other faculty and taking it back to the community, to our stakeholders, and so on. And unfortunately, before COVID, CETA had over 40 extension agents. Now we're down to 20. And this bill is extremely important to make sure that we can not only be able to work with our mission and our stakeholders, but we are providing the best opportunities and best possible solution to the farmers in Hawaii who are going to be affected by this bill. So thank you for opportunity to testify, and I'm here to answer any questions you might have.
Thank you very much. Next up, we have the Hawaii Farm Bureau.
Good afternoon, Vice Chair, Chair, members of the committee. Brian Miyamoto here on behalf of the Hawaii Farm Bureau. We'll stand on our written testimony in support of this measure. Thank you.
Thank you very much. Next up on Zoom, we have the Hawaii Cattlemen's Council.
Thank you, Vice Chair Kitagawa and members of the committee. I'm Nicole Galassi on behalf of the Hawaii Cattlemen's Council. We stand on our written testimony in strong support of this bill, as we're looking forward to building the resources for connecting research with producers for applicable and effective solutions for agriculture. Mahalo.
Thank you very much. Next, we have UPA.
Good afternoon, Chair, Vice Chair, members of the committee. Sarah Beamer for UPA. We stand on our written testimony.
Thank you very much. Is there anyone else wishing to testify on this measure? Yes, go ahead.
Angela Melody Young, testifying in strong support. The College of Tropical Agriculture and Human Resources was started in 1907, and the college is a academic institution in tropical agriculture, biological engineering, food science and human nutrition, fashion design, biotechnology, natural resources and environmental management, and family resources. Hawaii's unique geographic location, ecological diversity, and multicultural population provides the people from the college with a living laboratory. The college is the locus of educational opportunities, preparing the people who attend the college to become tomorrow's scientists, technologists, business leaders, family development specialists, fashion designers, nutritionists, and people who get involved in implementing policy. So thank you for the opportunity to testify.
Thank you. Is there anyone else wishing to testify? Okay, seeing none, committee members, questions? Oh, yes, Representative Ward.
UH Tropical Ag, please. Some have said without CTAR, ag would be never what it has reached to the point today, even plantation or small farms. The question is, why did it go from 40 ag agents to 20? What was the causation of that?
So this is related to number of issues. But first of all, we have lost number of positions. We also have a number of faculty and that have retired. And they have never been replaced, and that is also true with the agents. But number of positions also have been removed from the college.
But in terms of supply and demand, is the demand out there and you're just not meeting it? Or now with this one, you're going to get a few more people?
I have to tell you that we have absolutely excellent agents and specialists working in our college, and they're doing absolutely everything to work with all the farmers that need our help, but they are getting so stretched thinly that we really need more people to be able to provide the support to the farmers that need us.
Do you have any idea how many consultancies that you've given?
How many
farmers have been consulted over the last year?
I cannot remember that offhand. I can send you that information. We do have a nice report on it, but I just slipped my mind.
But you've got a great reputation in that CTAR.
Well, thank you very much.
Thank you.
Thank you.
Thank you, Chair.
Okay, thank you.
I have a question.
Okay, yes, Chair.
Okay, University. So over the years, one of the problems that we've had with CTAR and other areas in the university is when the positions become vacant, right? Then because we gave them autonomy, they scoop the positions and move it to someplace else, right? So have you tried the opposite, to try and scoop positions from somebody else and move it to you?
The one thing that I can comment on, that couple years ago, actually state legislator gave 10 positions directly for extension to CTAR, and all these positions, 8 out of 10 are filled, and the 2 they have recent retirement, and the university allowed us to refill
But what I'm
them.
asking is that have you worked through the regions to try and do the opposite, to try to get positions or through the university to get positions moved to you? Right now you have 2 vacant positions, the rest are all federally funded, right? They're vacant, A-funded positions, so you have 2 already that you can go after. But you should be going after internally, trying to move positions to you if it's important. Why have you been trying, and what's the obstacle?
So I have been the interim dean only for a couple months. So myself, I have had a conversation with the provost and the president during our meetings, and just emphasized to them importance of CTAR and how important CTAR is in the to our stakeholders and our farmers.
I would suggest that you try to work some of this internally, and then because I think that over the years CTAR has been shortchanged, and yeah, you need to work on this internally.
Okay, thank you for your comment.
Thank you.
Thank you very much. Any other questions? Okay, seeing none, seeing none, we're going to go on to the next measure, SB 155 SD1 HD1. It's relating to the University of Hawaii. First up, we have the University of Hawaii.
Good afternoon, Chair, Vice Chair, members of the committee. I'm Della Teraoka, representing the UH Community Colleges. We stand on our testimony in support, and I'm here if you have questions.
Thank you very much. Anyone else wishing to testify? Yes, go ahead.
Angela Melody Young, testifying in strong support on behalf of CARES. The UH Maui College's Office of International and Regional Partnerships is consistently developing bridges with the Maui County Sister City Foundation that connects students from Maui and abroad to develop meaningful relationships to help them in their careers, to help them develop their careers in this global community. And the immersive course designed for international students attending the UH Maui College represents Hawaii's heritage through the lens of its diverse multicultural community. Traditional and modern values of Hawaiian hospitality are at the center of this unique experience. And therefore, we are in strong support to appropriate funds for that school. So thank you for the opportunity to testify.
Thank you. Anyone else wish to testify? Okay, seeing none, any questions, members? Okay, seeing none, we're going to go to our next bill, SB 281 SD2 HD1, relating to the College Savings Program. First up to testify, we have the Department of Taxation.
Good afternoon, Chair, Vice Chair, and members of the committee. Gary Sugunuma, Director of Taxation. The department stands on its written testimony offering comments. Thank you.
Thank you very much. Next up, we have the State Council on Developmental Disabilities.
Aloha, Chair, Vice Chair, committee members. My name is Chase Silver, and I'm here for Dane Chief Bartolos for the Hawaii State Council on Developmental Disabilities. We want to stand on our written testimony. We just wanted to highlight and thank the legislator for including the ABLE savings accounts in this measure as well. Thank you.
Thank you very much. Next up on Zoom, we have the Tax Foundation of Hawaii.
Thank you, Chair, Vice Chair, members of the committee. Tom Yamachika from Tax Foundation of Hawaii. We will stand on our written testimony and be available for questions. Thank you very much.
Okay, thank you very much. Is there anyone else wishing to testify on this measure? Oh, yes, go ahead, sir.
Hello, everybody. My name is Don Ariyoshi. I've been working on this, on a College 529 bill, I think since Linda Lingo's administration, that first came out and offered a tax deduction only to contributions made to the Hawaii State Plan. When we started this, we opposed that. The industry came together. I think it's good to include the State of Hawaii plan, the ABLE savings plan, in the tax deduction. But I don't think it's right that you exclude all other contributions and say contributions only to the Hawaii State Plan should be allowed. And here's the reasons why. Is because if you look at the Hawaii State Plan, it's a very small plan. Most families in Hawaii have elected to make their contributions to other state-sponsored plans. And for various reasons, for whatever the reason is, different plan features, whatever their choices or the advice they got, that's what they decided on. So it's just a small number of families that are going to benefit if you make the deduction only to the State of Hawaii plan. We feel you should open up to all plans. Also, with the assistance of a financial advisor, many advisors cannot advise to the State of Hawaii 529 plan since Hawaii ended the advisor 529 plan many years ago. So I, working at Morgan Stanley, all my clients, if they wanted to invest in a 529 plan with the State of Hawaii, I cannot help them, educate them, explain to them what do they need in a 529. Do they need earnings? Do they need appreciation? What kind of risks do you take? What percentage do you go to equities to fixed income? How does all this work for the outcome for your child? And because we cannot advise on a plan, I don't know how people like you and your 457 deferred comp, if you didn't have an advisor, how do you make a decision in your retirement on what to invest in and what is your 457 deferred comp island savings plan going to look like in retirement for you? This is why having the advice of advisors I think is important. The other thing is that I don't think it's right for the legislature to direct families in Hawaii to one plan, because one plan does not fit all. Everybody has different suitabilities, different objectives. They have kids who have different needs. So therefore, directing Hawaii families into one plan only, I don't think it's the right thing. Also, we must encourage families, we must allow families, and we must encourage them and to include them and not to exclude them to contributions. That's why we feel it should be made to all contributions to any plans. You know, right now, one of the great solutions to our student debt that's exceeding 1.7 trillion is to have families plan ahead so they can pay for college education. I was lucky enough to invest early in a 529 plan because of my industry. Today, my kids are graduating with no debt. If we allow contributions to be made to all contributions to any plans, there are more kids who are going to come out that enter the workforce that may not be part of the student debt situation. Thus, we recommend to the House Finance Committee to amend the current draft to match the draft approved unanimously by the Senate and allow any deduction for any 529 plan, including the State of Hawaii 529 plan. Thank you very much.
Thank you very much. Anyone else wishing to testify? Go ahead.
Angela Melody Young, testifying on behalf of CARES, to provide comments. So the ABLE Act, which was signed into law in December 2014, allows Americans who are living with disabilities to save money for college and for other expenses. So similar to a 529 college savings plan, the 529 ABLE accounts are savings accounts administered by many states. And it is a federal provision that then states implement by customizing the plan. And so because this creates equity for disabled people, and for those who are in government, advocates, legislators, we should be providing equity for disabilities, right? Not making things more difficult for disabled people. And this is from the ADA Act, the Americans with Disabilities Act. It is a federal statute implemented by the Department of Justice, which creates provisions for disabled people. So if there's any way to kind of look into the 529 ABLE accounts and the ADA provisions, there could be a way to create more equity in this subject matter. So thank you for the opportunity to testify.
Thank you. Anyone else wishing to testify? Okay, seeing none, committee members' questions. Oh, yes, Representative Ward.
Mr. Ariyoshi, please. How common or uncommon is the 529 plan as you described? How many states actually have all this in statute?
Well, let me give you some facts here. This is from the National Authority on IRC Code 529 College Savings Plan from savingforcollege.com, Chris Stack. He is a national authority. He works with Congress. He's also been working with me since the Lingo administration. There are only 4 states, including Hawaii, that do not offer an incentive to participate in 529 plans through a state tax deduction. We encourage partnership. At least 7 states allow other state deductions for any 529 plan and have experienced no difficulty with enforcing their state tax laws. Hawaii is one of 4 states with an income tax that does not offer deduction for or credit for contributions to 529 plans. I think the Hawaii State Plan can also relook at itself and see how they can design the plan a little better. The Hawaii Plan is ranked number 50 among all state plans as of 12/31/2022, with 92 million in total asset value, 5,400 accounts, and Hawaii tax-paying families currently choosing to use other plans in other states. The total amount of invested in 529 plans across the country is about 400 billion.
Before I ask the Department of Taxation, how much is this going to cost to do the deduction? Do you have an estimated amount of the deduction? For Mr. Ariyoshi, yeah, you said, because DOTAX usually has a number that, hey, if we do these deductions, it's going to cost us so much money.
So when we worked with the Senate last year, we started doing this bill. We were asked to speak to Isaac Troy at that time. We did speak to Isaac. And Isaac said that he didn't have a problem with the 8,000 for joint filers, 4,000 for single filers. But he had a problem with, is this only for rich families or not? So what we did was we included in there income limits that reflect the Roth IRA contributions of $214,000 for joint filers, $150,000 for individuals, somewhere around there. And we also put a cap as far as 4,000, single fire 8,000. And we also put in there, so families don't put in the money on Friday, take it out on Monday and get the tax deduction. We also put in there a definition of what is non-qualified withdrawals. So it takes those people out. As far as the impact on state revenues, I don't have those figures. But we've been hanging around this 4,000 to 8,000 for a number of years now.
Thank you very much for your passion that you have for this. Chair, may I go to the DOTAX for their estimation? Any ballpark figures?
Yes, in our testimony it's noted, for this particular bill as written, $5.5 million revenue loss. Fiscal year ending 2024 through fiscal year ending 2029.
And your numbers are the same as Mr. Ariushi's 4,000, like 12,000 people are going to claim it? Is that what your number says? How many claimants do you put? Assumptions are only as good as the models that they're based upon.
I don't know that I have that figure available. I can check with our tax research and planning office that came up with a revenue estimate to see if you want to know what assumption we're using in terms of how many people have claimed.
Just so that you're on the same page, so to speak. But my sense is $5 million for getting people educated is very, very well worth, especially if it gives an incentive for any income bracket, as you just said, to participate in this. Thank you. Thank you, Chair.
Okay, thanks very much. Yes, Representative Kobayashi.
For DOTAX, have you talked to BNF about how they got their figures? They're saying that potential revenue loss would be about 1.5 million annually. So,
is that from budget and finance?
yes, I read you the exact words.
Yeah, I'm not aware of that
I mean,
estimate.
I can imagine that there might be a small difference in estimation, but not a 300% plus difference.
Yeah, I'm not aware of that estimate that you're talking about.
Oh, well, maybe sometime between now and conference, it would be good to know.
Yeah, I mean, as the bill has changed from committee to committee, I did notice that an earlier revenue estimate back in February had it at 1.8 million as a revenue loss of 1.8 million for fiscal year ending 2024 through 2029. But then since that time, it has been updated, and so that's, as more information becomes available, then the economists will adjust it, and so the current one is at 5.5.
Yeah, but I mean, make sure that you and BNF kind of agree.
Yes.
Thank you.
Thank you very much. Any additional questions? Okay, seeing none, we're going to go to our next bill, SB 1413 SD2 HD1, relating to the University of Hawaii resident tuition fee. First up to testify, we have the University of Hawaii.
Aloha, Vice Chair Farah Marie Gomes, Associate Vice President for Student Affairs with the University of Hawaii. Testimony has been submitted on behalf of Vice President Deborah Halbert. I am here to answer any questions that the committee might have. We stand on our testimony in support of this bill. Mahalo.
Thank you very much. Next up, we have the Department of Education.
Aloha Chair, Vice Chair, I'm Tammy Chen, representing Superintendent Keith Hayashi. Department of Education stands on its written testimony in support.
Thank you very much. Anyone else wishing to testify? Yes, go ahead.
Angela Melody Young, testifying in strong support. So the legislature finds that facilitating college education and training for high school graduates serves the state's goals, and this act, therefore, is a law of statewide concern. And so at CARES, we've we're developing a educational curriculum for the Kalihi community. And so, if there's any way to create equity at any level, especially in the college setting, then it is good. So thank you for the opportunity to testify.
Thank you. Anyone else wishing to testify? Okay, seeing none, committee members, questions? Yes, Representative Kobayashi.
Could UH give an estimate as to cost?
Oh, sorry, you're on Zoom. I mean mute.
Sorry about that. Yes, and that question did come up in the prior committee hearing, in which the estimate was provided at $150,000. We did since then go back and rerun the numbers. It is closer to $240,000. However, we do see that as a small trade-off for the benefits that the students who would be able to benefit from the most recent change, an additional 8 years in the duration of time. So we are in full support of this version of the bill.
The number is $240,000
Yes.
for all students,
Yes.
all campuses?
Yes. That is based on historic data that we pulled.
Thank you.
Thank you very much. Any other questions? Yes, Representative Ward.
Following question to the University of Hawaii. Isn't there an economy of scale that you could integrate these within the classroom without actually incurring any other charges? Question mark. How many
That
students?
is-
How many students are we talking about? What's the estimate?
The estimate based on our historic data, average 60 to 90 students per year that we're talking about. I do want to point out that there are two different components in this bill. One is the mere simplification of process for students graduating from high school. And we fully support that piece. Like whatever we can do to simplify the process from our students graduating from high school to seamlessly join the university community, that is a benefit for all of us. There are other populations that are indicated in the bill that have more complex situations, and that is a smaller number. So it might be possible to incorporate this, but we are looking for a more streamlined process and one that might fit into policy a little bit more cleanly without manual interventions that are necessary and additional documentation from students.
It would seem minor to integrate 680 students into your over, 20,000 size student body, generally speaking. The point is, if you integrate them in there, you're going to charge us the money even though your expenses probably will remain neutral. That's correct, or is it not?
That's probably correct, yes.
Okay, thank you very much. Thank you, Chair.
Okay, thank you. Any other questions? Okay, seeing none, we're going to go to our next measure, SB 500 SD1 HD1. This is relating to mental health at the University of Hawaii. First up to testify is the University of Hawaii.
Aloha Chair Yamashita, Vice Chair Kitagawa, and members of the committee. I am Lori Mio Ideta of the University of Hawaii at Manoa. We are incredibly grateful to the senators who introduced this bill in support of our students, and we are truly thankful for the members of the House for hearing this bill today. We stand on our written testimony in support. Thank you.
Thank you very much. Next up to testify, we have the Associated Students of the University of Hawaii.
Aloha, I'm Rudy Ramirez, and I serve as the president of the Associate Students of the University of Hawaii. We've all endured a great deal of hardship and uncertainty as a result of the COVID-19 pandemic, which we're seeing the lasting impacts of disconnection that came with social distancing to the overwhelmingness where our way of life was completely disrupted. These impacts won't simply disappear overnight, proving that we need to prioritize mental health resources. That's why I urge strong support for Senate Bill 500, which will allocate funds for 3 FTEs within the Counseling and Student Development Center at the University of Hawaii at Manoa. Mahalo.
Thank you very much. Next up on Zoom, we have Kelly Chan.
Aloha Vice Chair and members of the committee. My name is Kelly Chan and I am currently a graduate student at the University of Hawaii at Manoa. However, my testimony is not affiliated with the university. I am in support of the bill SB 500. I have personally struggled with mental health during my undergraduate degree, and seeing a mental health practitioner has brought me a new perspective on life and has helped me to understand how to manage my stress to continue to help me to accomplish my goals in both my personal and career life. Especially with the presence of COVID-19, students are dealing with much more than just academic stress, and there needs to be an increase of mental health professionals to provide services. Without seeing a mental health professional, I wouldn't be where I am today. Once again, I am in support of the bill, and thank you for your time and opportunity to testify.
Thank you very much. Next up on Zoom, we have Samantha Yee.
Aloha Chair, Vice Chair, and members of the committee. My name is Samantha Yee, and I am in strong support of SB 500. Mahalo for your time.
Thank you very much. Next up on Zoom, we have Noel Akbar.
Hello, Aloha Vice Chair, member, and members of the committee. My name is Noel Akbar, and I'm testifying in support of SB 500. I'm currently a graduate student at Myron B. Thompson School of Social Work at UH Manoa, with a focus in behavioral mental health, though I'm not testifying on behalf of the university. During my 2 years in the MSW program, I've had the opportunity to learn about the importance of therapy and mental health service accessibility for people in need. Free mental health services are crucial to students at Manoa, as many students are unable to receive outside care due to barriers such as insurance or income requirements. The Counseling and Student Development Center provides these necessary services to registered students for free, which eliminates said barriers. Also, the normalization of mental health services within government-funded programs and sectors expresses the acceptance and understanding of the needs of our communities. Overall, I believe that providing funding for the additional positions through SB 500 will increase accessibility and promote the well-being of our student community, which can in turn positively impact our communities as a whole. Thank you for your consideration.
Thank you very much. Is there anyone else wishing to testify on this measure? Oh, okay, go ahead.
Aloha, Chair, Vice Chair, and the committee of the FIN Committee, Angela Melody Young, testifying on behalf of CARES in strong support. So the purpose of this bill is to appropriate funds, and it is for the counseling, student development, and mental health. So, when we talk about like mental health, especially at colleges, people, they kind of never go to the root of why mental health counseling and support is needed, right? So there is a very specific kind of behavior that is very prevalent at colleges and schools that happens, that it's bullying. So abusive, aggressive behavior that causes people to suffer and to experience mental health conditions. This is why people need mental health support and counseling. So the CDC declares bullying is a form of youth violence and an adverse childhood experience. And CDC defines bullying as a aggressive behavior by another youth or group of youths, and it may inflict harm or distress on the targeted youth, including physical, psychological, social, or educational harm. So this is very prevalent amongst schools. And the U.S. Department of Health and Human Services declares kids who are bullied can experience negative physical, social, emotional, academic, and mental health issues. Kids who are bullied are more likely to experience depression and anxiety, and disturbances to their health patterns. And also, these sorts of mental health issues may persist into adulthood. And also, this affects their academic achievement, their GPA, standardized test scores, school participation. Kids, as declared by the U.S. Department of Health and Human Services, it says, kids who experience bullying are more likely to miss, skip, or drop out of school. So here in Hawaii, the City and County of Honolulu enacted Bill 52 to prohibit bullying of youths and to create a safe space for all the programs. And Bill 52 was implemented recently, and it is an effort to prevent bullying and to prevent retaliation on those who report bullying, and to create policies and procedures to provide a protected environment for youths. So it is written into an ordinance, a law, that you can't bully. However, it's only implemented at the city. So, community-wide strategies can help identify and support children who are bullied, redirect that behavior, and change the attitudes of those who tolerate bullying behaviors in peer groups, youths, families, and communities. So, to conclude, we should be supportive of providing counseling and mental health to the colleges, because these are all very prevalent concerns that students experience at schools. They pick on each other, start fights because they're bored, so we've got to provide the counseling. Thank you for the opportunity to testify.
Thank you. Anyone else wishing to testify on this measure? Okay, seeing none, committee members, any questions? Okay, seeing none, we're going to go to our last measure on this agenda, SB 1317 SD3 HD1 relating to broadband. First up to testify is the Office of the Lieutenant Governor.
Chair, Vice Chair, members of the committee. Hi, Riley Fujisaki on behalf of the Office of the Lieutenant Governor. We're just here to stand on our testimony and support. Thank you.
Thank you. Next up, we have DBED.
Chair, Vice Chair, members of the committee, Chris Sariasu with DBED. Happy to be here, and we stand in support. Thank you.
Thank you very much. Next, we have the University of Hawaii. Okay, no, not here. Next up, we have State Council on Developmental Disabilities.
Good afternoon, Chair, Vice Chair, members of the committee. My name is Nate Burns with the State Council, and we want to stand on our written testimony and support. Thank you.
Thank you very much. Is there anyone else wishing to testify? Yes, go ahead.
Angela Melody Young, testifying in strong support because on behalf of CARES. So many communities lack access to internet, and many more can't afford or don't know how to use it. And to create an equitable economy, we all need access to reliable, high-speed internet. And the Digital Equity Act provides $2.75 billion to establish 3 grant programs that create equity in digital connection and inclusion. So the Digital Equity Act aims to ensure that all people and communities have the skills, technology, and capacity needed to reap the full benefits of our digital economy. And so we are in support of creating more equity, for the Hawaii communities, for broadband. So thank you for the opportunity to testify.
Okay, thank you very much. Come on up.
Good afternoon, Vice Chair and committee members. My name is Dan Smith. While I am a member of the Hawaii Broadband Hui and of academia, I'm here in my own capacity. I want to address briefly the question of matching funds. And I think the order of magnitude of broadband money that will come into Hawaii is more like $400 million, and therefore I think you should think big, as in 25%, because it gives the state some flexibility and leverage in formulating infrastructure in the best interests of the whole population of the state of Hawaii. So that would be the point that I would say. And so $100 million would be order of magnitude to be spent only as if needed for important goals, and with some process that they involve checking with the legislature or the governors, whatever procedure you might devise, but give the state broadband program leverage. Thank you.
Thank you very much. Anyone else wishing to testify on this measure? Okay, seeing none, committee members, questions? Yes, Representative Ward.
Lieutenant Governor Luke, please. Oh, she's not here, but I was going to ask her, and maybe you know the question. How much money should we put in the bill? How much money does she want?
Thank you, Representative. So originally the bill was drafted for 33 million. I think we're still refining that number. There is more federal funds available, but we are working on getting that number together, and I can have.
So it's going to go up or go down?
I think they're anticipating perhaps asking for a little bit more, but it would still be around that same neighborhood.
Good, thank you.
Yeah.
Give her our regards.
Okay, will do. Thank you.
Thank you very much. Any other questions? Yes, Representative Kobayashi.
For Office of Lieutenant Governor, it looks like you have the standard boilerplate language about transferring, functions, offices, employees, et cetera. But what might help is additional language so that the current employees at DBED could physically stay in DBED offices, use DBED utilities, etc., and not have to find new facilities, new offices. That might help, especially if it's going to be a temporary 4-year transfer.
Yes, no, thank you, Representative. We are amenable to that. We're currently working with the department to try and fine-tune what some of the transfer would mean, including whether or not physically the positions would be housed up at the Lieutenant Governor's office or would remain with the department.
Yeah, but if you put it in language, you won't have to go through that negotiation.
Yeah, very true. Thank you.
Thank you.
Okay, thank you very much. Any other questions? Okay, seeing none, we're going to recess for about 30 minutes and then come back for decision making. So recess.
Okay, the Committee on Finance will reconvene for decision-making on our first agenda. First up is Senate Bill 7 HD1. Recommendation is to move out as is. Any discussion? Vice Chair for the vote.
Recommendation of the chair is to pass SB 7 HD1 as is. Chair and Vice Chair vote aye. Representative Ayu.
Aye.
Representative Chun. Representative Cochran.
Aye.
Representative Garrett.
Aye.
Representative Kahaloa.
Aye.
Representative Kila.
Aye.
Representative Kobayashi.
Aye.
Representative Lamosao. Representative Morikawa. Representative Nishimoto. Representative Poi Poi.
Aye.
Representative Takenouchi. Representative Alcos.
Aye.
Representative Ward.
Aye.
Chair, your recommendation is adopted.
Okay, thank you very much. Moving to House Bill 531 SD2 HD1, Senate Bill. Okay. Relating to education, recommendation is to pass as is. Discussion. Vice Chair.
Recommendation of the chair is to pass SB 531 SD2 HD1 as is, noting the presence of all members who will be noted present for the rest of this agenda. Are there any reservations? Any noes? Chair, your recommendation is adopted.
Okay, thank you. Senate Bill 1078 SD1 HD1 as is. Discussion. Vice Chair.
Recommendation of the chair is to pass SB 107 SD1 HD1 as is. Are there any reservations? Any noes? Chair, your recommendation is adopted.
Okay, thank you very much. Senate Bill 156 SD1 HD1 as is. Discussion. Vice Chair.
Recommendation of the chair is to pass SB 156 SD1 HD1 as is. Are there any reservations? Any noes? Chair, your recommendation is adopted.
Okay, Senate Bill 1022 HD1 as is. Discussion. Vice Chair.
Recommendation of the chair is to pass SB 1022 HD1 as is. Are there any reservations? Any noes? Chair, your recommendation is adopted.
Okay, Senate Bill 1232 SD1 HD1 as is. Discussion. Vice Chair.
Recommendation of the chair is to pass SB 1232 SD1 HD1 as is. Are there any reservations? Any noes? Chair, your recommendation is adopted.
Okay, so thank you. Senate Bill 971 SD2 HD1. We're going to move this out as an HD2. We're going to be taking the AG conforming amendments and tech. Any discussion? Vice Chair.
Recommendation of the chair is to pass SB 971 SD2 HD1 with amendments. Are there any reservations? Any noes? Chair, your recommendation is adopted.
Okay, thank you very much. Senate Bill 830 SD2 HD1 as is. Discussion. Vice Chair.
Recommendation of the chair is to pass SB 830 SD2 HD1 as is. Are there any reservations? Any noes? Chair, your recommendation is adopted.
Okay, Senate Bill 1586 SD1 HD1. We're going to move this out as an HD2, blanking out the FTEs and tech. Any discussion? Vice Chair.
Recommendation of the chair is to pass SB 1586 SD1 HD1 with amendments. Are there any reservations? Any noes? Chair, your recommendation is adopted.
Okay, thank you very much. Senate Bill 155 SD1 HD1 as is. Discussion. Vice Chair.
Recommendation of the chair is to pass SB 155 SD1 HD1 as is. Are there any reservations? Any noes? Chair, your recommendation is adopted.
Okay, thank you. Senate Bill 281 SD2 HD1 as is. Discussion. Vice Chair.
Recommendation of the chair is to pass SB 281 SD2 HD1 as is. Are there any reservations? Any noes? Chair, your recommendation is adopted.
Okay, Senate Bill 1413 SD2 HD1 as is. Discussion. Vice Chair.
Recommendation of the chair is to pass SB 1413 SD2 HD1 as is. Are there any reservations? Any noes? Chair, your recommendation is adopted.
Thank you. Senate Bill 500 SD1 HD1. We're going to move this out as an HD2, blanking out the FTE and tech. Any discussion? Vice Chair.
Recommendation of the chair is to pass SB 500 SD1 HD1 with amendments. Are there any reservations? Any noes? Chair, your recommendation is adopted.
Thank you. Moving to Senate Bill 1317 SD3 HD1 as is. Discussion. Vice Chair.
Recommendation of the chair is to pass SB 1317 SD3 HD1 as is. Are there any reservations? Any noes? Chair, your recommendation is adopted.
Okay, thank you very much, members. We're going to recess for 2 minutes and head into the next agenda. Recess. Okay, the Committee on Finance will come to order. Okay, we're going to be moving on Agenda 2. First up is Senate Bill 1296, ST2 HD1, relating to design economic development districts. First up is DBED. Okay, thank you very much. Office of Planning and Sustainable Development. Okay, thank you very much. Is there anyone else wishing to testify on this measure? Okay, seeing none. Members, any questions? No questions. Very good. We're going to move on to the next bill. Senate Bill 667 SD2 HD1 relating to nonprofit organizations. First up is Department of Taxation.
Good afternoon, Chair, Vice Chair, and members of the committee. Gary Sugunuma, Director of Taxation. The department stands on its written testimony, offering comments. Thank you.
Thank you very much. Next is Hawaii Alliance of Nonprofit Organizations. Hanor.
Hi, good afternoon, Chair, Vice Chair, members of the committee. I'm Lisa Mariyama with the Hawaii Alliance of Nonprofit Organizations, and I know I have a lot of people waiting behind me to testify, so I'll be really quick with some comments. This bill, Senate Bill 667, Senate Draft 2, House Draft 1, it's a really important bill to the nonprofit sector. In this bill, we outline that we would be asking the state of Hawaii to part with about $1.5 million in tax revenue that would exempt nonprofits from fundraising revenues, taxes on fundraising revenue. And this particular bill actually it would conform state law with existing federal law that already exempts taxes on this type of revenue. At the moment, the state of Hawaii does not tax donations, but it taxes donations that are given at fundraisers. So there is a discrepancy in the way that we tax revenue. Also, there's a double taxation because some of the nonprofits, when they hold these events, they actually are paying tax on goods and services to hold the event, and then they're paying it again on the gross revenue of the proceeds of the event. So there's a double taxation going on. And of course, the savings that nonprofits could incur by this exemption would actually be put back toward important missions. And I'm sure you'll hear a series of testifiers today who can share a little bit about how their missions would be positively impacted. One last technical thing that I would like to point out is there is a defective date on this bill, and we actually think that if we can change and correct the defective date, then barring any kind of other substantive differences between House and Senate versions, it might spare it having to go on for a conference committee if we can just fix the defective date. That's it from me. Thank you so much for indulging me and allowing me to make these points. Mahalo.
Okay, thank you very much. American Cancer Society, Cancer Action Network.
Thank you, Chair Yamashita, Vice Chair Kitagawa, and committee members. Cynthia Au on behalf of the American Cancer Society, Cancer Action Network. ACS CAN stands in strong support of Senate Bill 667, SD2 HD1. I wanted to thank the committee for hearing this bill and continuing the conversation. Nonprofit organizations rely on fundraising efforts to use for mission-related purposes. The American Cancer Society uses funds through social galas and other events for cancer research grants, patient services, cancer information through the website, a 24-hour hotline, which, as well as to support the operations of the Clarence T.C. Ching Hope Lodge of Hawaii, which provides free lodging for cancer patients and caregivers traveling to Oahu for treatment. Since 2016, the Hope Lodge in Honolulu, Hawaii has hosted thousands of guests from all over Hawaii and across the Pacific Island region. In a typical year, the Hope Lodge's 20 beds serves 800 guests, 400 cancer patients, and 400 caregivers. Annually, the lodge provides approximately 9,250 patient nights of lodging, saving guests more than $2.2 million each year in lodging costs alone. Again, it is completely free of charge to cancer patients and caregivers when their treatment requires their stay on Oahu, and transportation from Hope Lodge to their treatment is also provided at no cost. Without Hope Lodge Hawaii, patients pay an average of hotel nightly costs of $238. For a course of radiation that may last 30 days, the cost of lodging would be prohibitive, and patients may decide to forego treatment altogether. The current distribution of the stay at Hope Lodge is 58% from the Big Island, 15% from Maui, 14% from Kauai, 7% from Molokai, and the remainder with residency from Lanai, Guam, American Samoa, and other Pacific islands. Hope Lodge of Hawaii does not receive any Hawaii state grant and aid or city county grants. Every dollar goes towards the mission and to end cancer as we know it. Mahalo.
Okay, thank you very much. Next is Ryan Kusumoto.
Good afternoon, Chair, Vice Chair, and committee members. My name is Trisha Kajimura, here on behalf of Ryan Kusumoto and Parents and Children Together. We're a statewide social services agency serving 15,000 people annually with our 20 programs. Our fundraising efforts are substantial, and this measure would put those dollars back to use for our direct services. Thank you.
Okay, thank you. Tax Foundation of Hawaii.
Thank you, Chair, Vice Chair, members of the committee. This is Tom Yamashika from Tax Foundation of Hawaii. I wanted to point out that this year's bill has a small but significant difference from last year's bill that, of course, was passed and then vetoed by the governor. We believe, and we've had a meeting with Hano as well as the tax department to exchange views on whether this actually works, and we think that the problems underlying last year's veto have been resolved by this, small but important change to the bill. I'll be happy to answer any questions. Thank you for allowing me to testify.
Okay, thank you. Next up is Partners in Care, Oahu. Continuing Care. Okay, next is Esther Smith.
Hello, I'm Esther Smith. I am a board-certified family physician running a small clinic in Kealakekua, Hawaii. I come today in support of SB 667. 667 is a measure that would make federal tax law, or would make Hawaiian tax law look more like federal and be more in a line. Similarly, removing the tax from TRICARE, Medicare, and Medicaid would make Hawaiian tax law more in keeping with federal policy. Further, as tax law is meant to further services for our most vulnerable populations, similarly, removing the GE tax from that, from Medicaid, Medicare, and TRICARE would assist in providing care for the underserved. I would propose this as an amendment, unless, of course, SB 1035 will be heard on its own. Thank you.
Okay, thank you very much. Okay, that's all I have signed up to testify. Is there anyone else wishing to testify? Please come up.
Aloha, Chair.
Oh, hold on. Okay, you can proceed on Zoom.
Thank you. I'm Judith Clark, Executive Director of Hawaii Youth Services Network, a statewide coalition of youth-serving organizations, and we're in strong support of this bill. I did submit written testimony, but I did submit it late. We know that this bill will benefit thousands of nonprofit organizations in Hawaii, and more importantly, the hundreds of thousands of children, youth, families, and kapuna whose lives are made better by the services that these agencies provide. By eliminating the excise tax on fundraising revenues, we will be able to devote more revenues directly to support our most vulnerable citizens. Thank you for this opportunity to testify.
Okay, thank you very much. Is there anyone else wishing to testify? Please come up.
Angela Melody Young, testifying on behalf of CARES in strong support. So generally, for-profit companies seek to provide a product to consumers, and it's for profit. And a nonprofit organization's purpose is to provide a benefit to the community with no intention of earning a profit. Instead, they're fully focused on improving the social aspect of the community. So in most cases, for-profit companies have a very specific defined audience for their product. And many for-profit businesses perform extensive research and analysis to find their ideal audience and then devote resources to ensuring that a segment of the population knows about the product. Nonprofits usually have a much broader audience. Most appeal to a market that includes the community the nonprofit helps, and also the volunteers or other stakeholders who work with the organization. And nonprofits put on a lot of fundraisers, and it's to educate the community, and so we should be supportive and to create more equity for the nonprofits. Thank you for the opportunity to testify.
Okay, thank you very much. Is there anyone else wishing to testify? Okay, members, questions? Representative Ward.
Mr. Yamachika, Tax Foundation, are you still online?
Yes, sir.
Mr. Yamachika, every year we usually do a conformity with state law and federal law. Did we skip over this a number of years ago when we didn't do the nonprofits with this particular issue?
The conformity, sir, is with income tax and generation skipping tax laws. It does not apply to GE tax, which is fundamentally different from federal most of the time. So, yeah, it's like kind of comparing apples and oranges. But there are instances where the GE law and the federal law do track closely, and one of the areas where there's been a lot of difference and therefore misunderstanding has been in nonprofit organizations. What kind of income is taxable? There are two different standards, one for state, one for federal. This bill seeks to bring them closer together.
And do you know how many nonprofits we're talking about? Would they be affected by this? Or that's
I would think all of them. Anyone who puts on a fundraiser or and yeah, probably fundraising is the main target of this bill.
I'm trying to get how many nonprofits are there now? There are more nonprofits, my understanding is, than partnerships or corporations. Maybe DOTEX knows this one, perhaps.
I would suggest that Hano would be able to
Hano.
answer that.
Okay, Hano. Okay, yes, please, unless the chair says otherwise. Do you have a number? How many?
Rep. Ward, it's
nonprofits?
over 7,000.
7,000.
Charitable nonprofits.
Okay, so that would hit very many. And if DOTEX did say it's 1.5 million, if you take 4.5%, reverse the mathematics by division, that's a lot of money that these nonprofits raise then.
So the way that DOTEX came up with their own methodology, and Mr. Sugunuma maybe can speak to that, but Hano did a sampling of the top 800 largest nonprofits and looked at the fundraising revenue that they actually incurred in the past, and this was before the pandemic. And so he came up with the amount of 1.5 million as a representative amount that we could fairly say would be the exempt revenue.
And of the other states, how many nonprofits are treated the way that they would be in Hawaii? I know they wouldn't have GET tax, but do they have any taxation comparable
So
to
in
us?
other states, there's sales tax generally, so it's the formulation's a little different, and maybe Mr. Yamachika can speak to some of that research around sales tax versus general excise tax. So it's a little bit different, and there are some states that actually exempt.
That was my point, the exemption part of it.
That's right. So I couldn't give you an exact number of states that actually exempt, but it's quite a few.
Lastly, of interest to the Finance Committee, would this help lower the need for GIA grants to nonprofits?
I wouldn't expect that to be. I think that there are many
don't
different
trust
ways
us.
in which nonprofits need to bring in revenue. And, many nonprofits also have government contracts, right, with the state of Hawaii. And oftentimes we are asked to fundraise in order to become less dependent upon the, grants and aid or state contracts. So to actually be taxed on the fundraising revenue when we are attempting to diversify our funding streams I think is a little bit unfair, especially if we're being asked to wean ourselves off, sort of government partnership.
Thank you very much. Thank you.
Thank you. Anyone else? Questions? Okay, moving on to the next bill. Senate Bill 795 ST2 HD1 relating to taxation. First up is Department of Taxation.
The department stands on its written testimony, offering comments. Thank you.
Okay, thank you very much. Next is DBED.
Yes, Georgia Skinner on behalf of DBED, we stand on our support of this measure and here for any questions.
Okay, thank you. Honolulu Film Office, City and County of Honolulu. On Zoom.
Aloha Chair, Vice Chair, members of the committee. Honolulu Film Office stands on its written testimony and support and will be available if there are any questions.
Okay, thank you. Motion Picture Association.
Yes, Melissa Patak here on Zoom. Chair Yamashita and Vice Chair Kitagawa, thank you so much for the opportunity to present this bill. We stand on our written testimony. Just a couple of points. Number one, we're the trade association for the leading producers and distributors of your favorite movies and TV shows, Disney, NBC Universal, Netflix, Paramount, Sony, and Warner Brothers, all who enjoy your generous and robust production tax credit and enjoy the opportunity to work and make their movies and TV shows in Hawaii. This is a clarification. It has the support of DOTAX and DBET. We appreciate working with both agencies to clarify a provision that was enacted last year regarding the GET withholding. This will be provide an opportunity to correct any inadvertent mistakes, or in the case of someone who hasn't provided a GET license. So we appreciate your support, and we hope the committee also supports the bill. I'm happy to answer any questions, and again, thank you.
Okay, thank you. Tax Foundation.
Thank you, Chair, Vice Chair, members of the committee. Tom Yamachika from Tax Foundation of Hawaii. We believe that this bill does bring some relief from the rigidity of some of the requirements that were enacted in the production credit regime last year. We'd be happy to answer any questions. We did testify in writing as well. Thank you, and we'd be happy to answer any questions.
Okay, thank you. Island Film Group. Oh, it's not here. Okay, anybody else wishing to testify on this measure? Okay, please come forward.
Aloha, Akayaka, Chair, Vice Chair. Angela Melody Young testifying on behalf of CARES in support. So the film industry, so there are film and music classes at West Oahu. HCC's got the Mele program. It's a music production program, and it works with singers, artists, and sound engineers. And then there's also a creative media program at UH West Oahu. Expanding the film industry to create more equity and more opportunities for for people who attend the colleges, but also for the film industry, such as SAG and the people from LA, is a good idea because it is a good economic opportunity for Hawaii. And although there is risks such as commercial producers who exploit the land, or perhaps commercial activities, there are policies within the tax incentives for the state film policies, and that can be regulated so as to protect natural resources. And so if you can imagine, why the film industry
Okay, you know what? We're going to ask you to kind of stick to what the bill is trying to achieve. Thank you.
Let me just see. Okay, so thank you for the opportunity to testify.
Okay, thank you. Okay, is there anyone else wishing to testify on this measure? Okay, members, questions? Okay, no questions. Very good. We're going to move on to the next bill. Okay, Senate Bill 1437 SD1 HD1 relating to pass-through entities taxation. Okay, first is Department of Taxation.
The department stands on its written testimony, offering comments.
Okay, thank you. Chamber of Commerce of Hawaii. Not here. Okay, Grassroots Institute of Hawaii. Not here. Okay, let's see. Pacific Rim Land LLC. Okay, thank you. Tax Foundation.
Thank you, Chair, Vice Chair, members of the committee. Tom Yamachika from Tax Foundation. This bill is basically trying to let what we call pass-through entities, which right now don't pay tax by themselves, but their owners pay tax. And it would involve those kinds of entities, and the issue that has come up is a federal issue, and that is the $10,000 deductibility limit on paying state tax. It's not an issue for state purposes because we didn't adopt that federal provision, so it's entirely a federal issue if we adopt this bill. What I wanted to point out is that the bill currently allows for this treatment, i.e. making the enabling the pass-through entity to pay tax as opposed to the owners. Right now, it applies only to partnerships and S corporations. We believe that there are a lot of small businesses around that operate in the form of limited liability companies with a single owner, sometimes known as disregarded entities. I do, for example. So I think that relief should be extended to those kinds of pass-through entities as well. I have in my testimony suggested language to make that happen, and I'd be happy to answer any questions. Thank you very much.
Okay, thank you. Next, Kapolei Chamber of Commerce. Not present. Okay, anyone else wishing to testify on this measure? Okay, members, any questions? Okay, very good. We're going to move on to the next bill, Senate Bill 1016 SD1 HD1, related to public-private partnerships for delivery of healthcare services. First up is, I don't have anybody signed up to testify on this, but anybody here present want to testify on this measure? Okay, seeing none, we're going to move on to the next bill, Senate Bill 62 SD2 HD1, relating to medical education and training. First up is University of Hawaii. Okay, not present. Okay.
Aloha. Sorry, I'm trying to get my video
Okay.
done. Aloha. Thank you, Chair, Vice Chairs. This is the Waikensei Holam, Interim Dean for the University of Hawaii School of Medicine. Thank you very much for bringing this bill. Here to stand in support of our testimony. Mahalo.
Okay, thank you. Next is Hawaii Pacific Health. Thank you. Kaiser Permanente.
Chair, Vice Chair, Jonathan Nick, President of Canada.
Okay, thank you. Hawaii Medical Service Association, HMSA. Thank you. Esther Smith.
Hello, I'm Esther Smith, and I am a member of the Hawaii Provider Shortage Crisis Task Force, and I speak in support of this measure. We are in desperate straits for a variety of specialties in primary care, especially on Big Island, and this could be of help. Thank you.
Okay, thank you. Anyone else wishing to testify on this measure? Okay, seeing none, members, any questions? Okay, nobody. Okay, moving on to Senate Bill 164 SD2 HD1, relating to loan payment for healthcare professionals. First up is Department of Health.
Chair, the department stand on its testimony for support.
Thank you. University of Hawaii. Thank you. Thank you for being here. Next up is Department of Labor and Industrial Relations. Here. Okay, next is Hawaii State Center for Nursing. Okay, thank you. Next is Jennifer M. Ewan on Zoom.
Aloha representatives, I'm Jennifer Lam Ewan, a Master of Social Work student at UH Manoa, and I'm testifying in support of SB 164 because I believe that if the state should invest in anything or anyone, it should be Hawaii's healthcare system and its professionals. Mahalo for the opportunity to testify.
Okay, thank you very much. Hawaii Pacific Health. Thank you. Kaiser Permanente. Okay, Queens Health System on Zoom.
Chair will stand our testimony.
You are in person. Thank you. Okay, and Aloha Care.
Chair, Vice Chair, members, not going to
Thank you. HMSA. Thank you. Esther Smith. Okay, thank you. Let's see, did I miss anybody? Oh, I missed somebody. Pax Charles.
Hi, thank you so much, Chair, Vice Chair, members of the committee. I just want to testify in support of this measure. I'm also a graduate student in social work at the University of Hawaii at Manoa, about to enter the workforce, and I think it's incredibly important to focus on measures like this one that will help us to retain healthcare workers. I also stand in support of my written comments and written testimony. Thank you so much.
Okay, thank you. Anyone else wishing to testify on this measure? Okay, seeing none, members, question? No question. Okay. Senate Bill 63 SD2, we're going to move on to the next measure. Senate Bill 63 SD2 HD2 relating to nursing. First up is Hawaii State Center for Nursing. Okay, thank you. Board of Nursing. Thank you very much. Next is Grassroots Institute. Not present. Okay, next is Healthcare Associations of Hawaii. Hilton.
Good afternoon, Chair, Vice Chair, members of the committee. Thank you for the opportunity to testify. My name is Hilton Rayfield, President and CEO of the Healthcare Association of Hawaii. We support HD2 version of the bill, which amongst other things incorporates a 10-day period for completed applications to be processed. And we look forward to continuing our work with the DCCA on this important measure and ask for your support in passing this bill. Thank you.
Okay, thank you. Next is Hawaii Pacific Health. Okay, thank you. Queens Health System.
Chair, I will stand our testimony, very strong support of that. Thank you.
Okay, Kaiser Permanente.
Stand in support.
Thank you. Anyone else wishing to testify on this measure? Okay, members, questions? Okay, very good. We're going to move to the next. Chair, Representative Ward, please proceed.
Hilton, please. Hilton, what are the ball scores for the number of doctors we're short and the number of nurses we're short? Do you have any ball score estimates? How many are we short?
Nurses right now, we have approximately 1,000 RN vacancies. That's just RNs. If you look at LPNs, that's in addition to that, but around 1,000 RN vacancies right now in the state of Hawaii.
So this bill will take a big bite out of that? Theoretically?
What this bill does is allow us to, and we really appreciate the collaboration with the DCCA, it does allow us to bring nurses into the state on an as-needed basis. DCCA is working very hard to process applications, but because we're so short of personnel right now, this does give us the opportunity to bring in nurses into the state on an as-needed basis. And many of those nurses, even if they're coming in to work permanently, we want them to be able to work in the state as soon as they get here. And as opposed to, if it does take a while for them to get their license through, if they have a valid unencumbered license in another state, this permits them to work in that state, work in this state while they are going through the application process.
And this supply side, there are enough nurses who would obviously be interested in this.
It's a challenge. We have, right now, we have about 600 nurses in the state from the mainland. Some of those are in the process of applying for, becoming permanent employees in the state. Others of them are here on a temporary basis. But unfortunately, until we can ramp up and train more nurses, we'll have to continue to rely on temporary nurses for a period of time, and this bill gives us that opportunity to bring in staff on an as-needed basis.
Okay. Thank you very much.
Thank you.
Thank you, Chair.
Okay, thank you. Any further questions? Okay, thank you very much. We're going to move on to the next bill, Senate Bill 674, SD1, HD1, relating to interstate medical licensure compact. First up is Hawaii Medical Board. Thank you. Grassroots to the Hawaii. Not here again. Okay, next is Hawaii Pacific Health. Okay, thank you. Queens Health Systems.
Chair, will send our testimony very strong support of this measure.
Thank you. Lower Care. Thank you. Kaiser Permanente. Okay, thank you. Next is HMSA. Okay, Esther Smith.
Hello again. I would like to take just a moment to explain why I'm here. Most physicians are unable to speak on any issues as they are employed by large organizations that enforce pretty strong gag rules on them. So they cannot stand here before you and give you a statement about how we feel about anything. We are approximately 1,000 physicians short in Hawaii. This leads to a state of constant desperation. I could not find a neurologist for a patient with a brain tumor. I can't find, and there is not a rheumatologist on Big Island. There is not an endocrinologist I can send my patients to. And sometimes even the large organizations fail to be able to get my patients the follow-up they need. The healthcare crisis isn't looming, it is here. People are getting sick, people are not getting the care that they need, people are dying. And I appreciate Bill 674 making licensing easier. It continues a pattern, however, of the state wanting to put patches on healthcare, to put a Band-Aid on a hemorrhage. So 674 will certainly allow more locums to come here and have a lovely 6 months in Hawaii while they put their finger in the dam for just a minute for us. And I will be grateful for any time I have with the specialists that I will have because that there will be more locums here. Locums who cost more money per shift, when really I beg of you to address the actual problem, which is reimbursement. But thank you for hearing 674. Thanks.
Okay, thank you very much. Next up is Robin Rohr on Zoom. Present. Okay.
Yes.
Oh, please.
Can you hear?
Yes, I can. Please proceed.
Start my video. Okay.
Here we go. You can proceed.
Can I be heard?
Okay, go ahead. We can hear you.
Are you giving me the ability to be heard?
Yes, please. Yep. Yes, please proceed.
Thank you so much. I'm testifying via Zoom, and Mr. Chairman Yamashita and members of the Finance Committee, thank you for this opportunity to speak on Bill 674. I am here speaking on behalf of large groups of veterans and many veterans groups who I've worked with over the last many years, including the Veterans Affairs Task Force of Hawaii and the Pacific under the chairmanship of John Henry Felix, AMVETS Hawaii under the leadership of Commander Donovan Lazarus and the General Hank Stackpole Legacy Committee for the Alleviation of Chronic Pain. Yes, agreement with Senate Bill 674. However, as one of the mayors of the Outer Islands said, we are in the middle of a healthcare catastrophe. And as one of our speakers said just a few moments ago, it has arrived. It's been here for many years. And with almost 1,000 doctors as a deficit, a horrific statistic, patients are dying, sadly. And we hear about those realities all the time. However, we do believe there is a solution. And we would ask humbly that in order to make this bill a reality, that before Tuesday, if the chairman and the committee would schedule SB 1035, which is to exempt the excise tax, which is not asked by any other state of physicians, and to reevaluate the reimbursements for Medicaid, that would be a beginning step in the right direction to retain our physicians. We were just voted on a national survey as the worst state in the United States for physicians to practice. Let's change that now. Let's schedule 1035 and 397 before Tuesday for a hearing so we can solve this problem. Thank you to the committee.
Okay, thank you very much. Is there anyone else wishing to testify on this measure? Okay, seeing none, members, question. Representative Ward.
Chair, the physician testified. Yes, the one who mentioned the gag rule. Sorry, I forgot your name.
I'm Esther Smith.
Because Esther, that was a very memorable comment. I appreciate your candor.
I was recently at the Hawaii Academy of Family Physicians meeting, of which I'm a board member, but I am not speaking on their behalf today. There was an older doctor who's been in leadership of that organization, has been very prominent in politics for decades. He is now employed by one of the largest hospital organizations in Hawaii, and he's no longer speaking politically. He's actually been giving me pointers on things that I should say because he can no longer speak on them. When you go to work for, I'm just going to go for it, if you go to work for a Queens or a Kaiser or a Straub, they do not want you speaking out politically. You risk your employment.
I want to go back to where you said this bill that we're talking about will get will get people here.
Mm-hmm.
They'll have an enjoyable. How long do they stay, and then how many people actually come and not return to the mainland but do stay? In other words, the efficacy of this bill.
The hope would be that people would come here and want to continue to work. My concern with that is that if you are a specialist coming into a community that has a severe shortage of whatever kind of specialist you are. For example, if you are a urologist and you're coming here on a temporary assignment where you may be the only urologist who's been in town for the last 6 months, you don't get to see any simple, like, enlarged prostates. You do nothing but, like, advanced prostate cancer all day, which is exhausting, right? Because you only see the most acute cases, the most severe cases. And so that's not a really great recruitment tool. Making licensure, I have to say, actually, getting licensed in Hawaii was quite difficult. Like I still have the phone number on speed dial, so from when I did it for myself. And so making it easier to apply will definitely get more people who've daydreamed about coming here to come here. It's just that it won't get them to stay. Locums jobs can range from like 3 months, 6 months. They're very lucrative for the people who take them.
But you said the key is not this bill, but the issue is reimbursement. How much of a percentage are we off? If we're last in the, I know that's getting a little outside of, but how off the mark are we? Half? 50%, 20%, 30%, what?
Kaiser Family Foundation, I think put us we're in like the bottom 10 for Medicaid spending versus Medicare, for example. We are dead last for favorability for physician practices. That was in the Wallet Hub survey. That is unchanged over the last 3 years. there's another bill coming up, and I'm just going to talk about it now just briefly, and that it's about physician's assistants and using them to solve the problem. Well, while physician's assistants in Hawaii are some of the best paid nationally, just grossly, they are 50th in the nation for getting paid once you factor in cost of living. I think family physician-wise, I think we're 53rd in the nation for pay. Meanwhile, we are the most expensive state to live in. People have to realize that basic economic forces still apply in medicine. As altruistic as we expect our physicians to be, in the end, you are going to go somewhere that pays you twice as much. Further, like, if you're talking about like loan repayment, or you're talking about having more students come out into our communities, because that's another thing that we're talking about today. If your son or daughter is a doctor, would you tell them to stay here, make half as much money, never be able to own a house, never be able to put their kids through college? Would you tell your kid, if they were a doctor, to stay here?
My daughter's an attorney in Boston.
I believe they're paid better there also, but yes.
True. Okay, thank you for your frank assessment, and I assume you're going to stay in Hawaii and fight this for your doctors.
I have been thus far. You know, it's actually really hard. I have been running my clinic off of my retirement savings from my last job in Arizona for the last 2 months.
Thank you for
I have 2,500 patients. We have a full clinic all the time, and we can't make ends meet. I have half as many staff as one would expect me to have.
Thank you for the model that you're doing and surviving. Thank you. Thank you.
Thank you very much, Representative Kahalo.
Healthcare Association of Hawaii, Hilton, if I may ask a question. Hello.
Hi.
Would it be would this bill be helpful if ancillary services were added to the licensure compact in the list of this bill, and why or why not?
I don't, we've not looked at that sufficiently, but in principle, yes, because the whole purpose of this bill, just like the nursing bill, is to provide a mechanism for medical personnel to more easily come into the state. There are larger issues that have been described, but certainly in times of stress, like during the pandemic, if we were to have a hurricane, a tsunami, something like that, the ability to bring in licensed personnel, whether it's doctors, physicians, ancillary personnel, readily is critical to being able to take care of the people of Hawaii. But that's an issue we'd have to, you know, we could do some research on, but I just can't give you an answer off the top of my head on that.
Thank you.
Thank you.
Okay, thank you. Any further questions? Okay, thank you very much. We're going to move on to the next bill, Senate Bill 599 ST1 HD1 relating to health. First up is DCCA. Okay, thank you very much. Hawaii State Center for Nursing. Okay, thank you. Next is Kaiser Permanente.
Chair, will stand under review.
Thank you. Hawaii Board of Hawaii Medical Board. Okay, thank you. Board of Nursing. Okay, thank you. Hawaii Pacific Health. Okay, Esther Smith.
I stand in support of this bill also. However, it must be acknowledged that the reason this bill is necessary is that we do not have enough pulmonologists or intensivists to be writing these orders. Thank you.
Okay, thank you. Anyone else wishing to testify on this measure? Okay, thank you very much. Members, questions? Okay, we're going to move on to the next bill, Senate Bill 693 SD1 HD2 relating to pharmacists. First up is Office of the Auditor.
Good afternoon, Chair, Vice Chair, Committee members. Jerry Book on behalf of the Office of the Auditor. Stand on our testimony, Office of Auditor, and I'm available to answer any questions.
Okay, Okay, thank you. Board of Pharmacy?
Hello, Chair and Committee, I'm James Hughes, Chief Executive Officer of the Board of Pharmacy. It's not on our submission.
Okay, thank you. Walgreens? Yeah, President. Okay, next is Hawaii Pacific Health. Thank you. HMSA? Thank you. The Hawaii Pharmacists Association? Okay.
Aloha, my name is Corey Sanders. I'm president of the Hawaii Pharmacists Association. We stand on support with the intent of this bill, but in the last committee, it was changed to a sunrise study to be delayed for implementation prior to going into effect. I just want to provide some additional comments to the committee. We've heard today that we're in the midst of a healthcare crisis, and this bill is asking for pharmacists to be able to be paid for any services that are provided already within our scope of practice. So we're not asking to expand our scope. We're only seeking to be able to bill for the services that we're already able to provide under state statute to help alleviate the burden of some of the healthcare system and the providers that have spoken earlier today. So if we do need an audit, we are in support. We are in support in the intent of the bill, but I just do want to make that comment that because this model doesn't exist yet in the state, I don't know how we'll properly audit something like this. And we are seeking to have the same treatment that the APRNs got in 2009 when they implemented the exact same issue without an audit. So in 2009, this was allowed to go into implementation without the audit because of the healthcare crisis. And we looked at the difference between the statistics in 2009 and here in 2023. They're absolutely striking. We're not in the middle of a shortage. We're now in the middle of a crisis. So we do want pharmacists to be able to be billed immediately for the services within our scope of practice, and we feel the best way to do this is to go ahead and implement it and then do a retrospective analysis 5 years later, similar to the APRNs did in 2009. Thank you, and I'm happy to answer any questions.
Okay, thank you. Next is Chad Kawakami on Zoom.
Good afternoon, everybody. Good afternoon, Honorable Chair Yamashita, Vice Chair Kitagawa, and members of the Finance Committee. My name is Chad Kawakami, and I've been a practicing pharmacist in Hawaii for 20 years. Let me tell you just a brief story. Today's special snack day. Every Thursday, since she was in kindergarten, Grandma would go pick up Emma after school. They would have French fries at McDonald's. Emma looks forward to snack day every time. No deal, no different. But today's a different day. Grandma can't pick her up because she was dizzy yesterday and she fell around lunchtime. She's at the hospital with a broken hip, and doctors think that her medications were the cause. Pharmacists, we're the drug experts, trained to work with physicians, ensuring medications are effective and do no harm. We are eager to work with providers within our communities, allowing everybody to practice at the top of their license. Together, we can increase access to medical care statewide. The College of Pharmacy graduates pharmacy leaders who provide care in local communities. Our graduates care for patients, improve quality of life, and bridge care gaps where there aren't enough providers. Unfortunately, we cannot expand services to our vulnerable kupuna, many who live in rural and medically underserved communities, because pharmacists do not have a reimbursement mechanism. Our students are trained, but many leave Hawaii because of lack of jobs. This is the most consequential bill for our profession that I've seen in the last 20 years for sure. Senate Bill 693 would provide financial compensation for licensed pharmacists so we can continue to transform healthcare delivery in Hawaii. This bill ensures pharmacists will continue to care for kupuna, like Emma's grandmother, by reviewing and stopping harmful medications. Emma looks forward to creating many more memories with Grandma and on all of those snack days. And maybe next time, instead of French fries, it'll be a McFlurry. Thank you very much for allowing me to testify in support of this bill.
Okay, thank you. Anyone else wishing to testify on this measure? Okay, seeing none. Members, question. Representative Ward.
If I may, Chair. Mr. Kawakami, are you still there?
Yes, sir.
I have a very naive question. I'm not sure what the scope of practice is that you're referring to. When I go to Long's, I see the pharmacist, he's doing pills and not prescribing, but kind of distributing. What are some of the scope of practices that the reimbursement is, that is being, or services that are being done that are not being reimbursed that this bill addresses?
So an example would be comprehensive medication therapy management. So I work with a lot of elderly who are on many different medications, upwards of over 10, sometimes even 15 medications. I review each medication for potential side effects, what's working, what's not working. There are many medications that are not appropriate for our elderly. It can cause them to have falls, can increase their risk for another heart attack. And my job is to review those medications, identify some of those medications, and then I work with each physician to help deprescribe or discontinue or remove those medications.
So do the
If you go
patients?
if you walk down the aisle briefly at, say, a CVS or at a Walgreens pharmacy, and just, I can probably, there are so many of those medications that can cause harm, dizziness, and falls. And it is our job as pharmacists to make sure that all the medications don't cause any harm.
But do the
But right
patients
now,
come?
when I do
sorry.
those services, I can't get paid.
I'm still trying to get the picture. So do the patients come and sit with you? Because you guys are usually behind something or some plexiglass or a counter. Do you actually have a place where you meet with the patients, or how do you do what you just said?
So pharmacists practice in many different settings. One is in the community that you're just describing. The practice setting that I used to practice in at the Department of Veterans Affairs, we have a clinic. It's like walking into a medical building in a doctor's office, where patients will come in, check in, and have a scheduled appointment with me one-on-one.
And you will prescribe medicine in that appointment or diagnostic with the patient?
So in the some different institutions provides us the opportunity to prescribe, but it's not really what I'm getting at this moment. Right now, I'm just getting at the ability to make an assessment, see patients, and get paid for that assessment that we're providing.
I guess what I'm leading to is that you're almost behaving as a doctor, and we have a shortage of doctors. I'm trying to pull you over to the other side, the same way that APRNs are stepping up. And,
Yeah.
and you said
Yes.
that there's people leaving because there's not jobs, which in this case is unfortunate.
Yes, in many different institutions, some pharmacists already practice under a scope of practice or have a collaborative practice agreement with physicians that allow us to essentially prescribe medications under that scope of practice. So yes, many pharmacists do have that ability to prescribe and discontinue medications.
Thank you very much. Did you go to school in Hilo, by the way?
No, I didn't. I went to school at Oregon State University. At the time, there wasn't a college of pharmacy here on Oahu.
I see. Thank you for coming home. Thank you, Chair.
Okay, thank you. Mr. Kobayashi.
For the auditor, if you were to do this sunrise analysis via a bill, would it conform to the requirements of statute?
We don't believe so. There is a specific statute that requires a concurrent resolution to
Right.
analyze a bill. This is a bill requesting us to analyze a prior version of the bill.
Thank you. So, do you know if there is a concurrent resolution that will do a proper sunrise analysis?
We have indicated in our testimony that SCR number 17 had been moving at some point in time. I apologize, I don't know what the current status of that resolution is.
I mean,
I wrote.
It has to have crossed over already. Okay, thank you.
If I may, I will also note that there is a space for an appropriation in this measure, and sunrise analyses are typically done by the Office of the Auditor. So if there was an idea that there would be an additional study or something that we would contract for, it's not indicated in this measure.
Okay. But if you were to do it under this bill, it would be an invalid sunrise analysis.
Oh,
Thank you.
thank you.
Okay, thank you very much. Any further questions? Representative Ward.
Chair, I was informed by a colleague that there's another pharmacist who I need to call upon, who's sitting in the back, whose hand I missed.
Okay.
And I'm sure she remembers.
I would appreciate if the hand raising stuff doesn't happen, because if you just call on who you want to call, because this is not a conversation, and I just want to stop that practice where people in the audience, okay, everybody should understand, the process is the members ask questions to a specific person, and that person answers the question. This is not a conversation, right? So it is not where you can just chime in when you want, raise your hand, whatever. So I know you're trying to get information. You can talk to her after if you want to.
I didn't see her hand. That was my point.
Okay, I'm just saying.
Yes.
That's proper, proper procedure for this committee, and technically for every committee, right? When we go into questions, the procedure is you ask questions to a specific person. That person answers the question, and the members can do the same thing.
I'll see you in the hallway.
Okay, thank you very much. Okay, any further questions? Okay, we're gonna move on to the next bill. House Senate Bill 759 SD2 HD1 relating to health. First up is Department of Health. Okay, thank you very much. Next is Hawaii Island Community Health Center. Here. Okay, is there anyone else wishing to testify on this measure? This is where you stand up and speak. Okay. Seeing none, members, questions? Okay, no questions. We're going to move on to the next bill. Okay, Senate Bill 759 SD2 HD1 relating. Oh, I did that one. Okay, next bill. Senate Bill 900 SD2 HD1 relating to the Hawaii State Health Insurance Assistance Program. First up is Department of Health.
Good afternoon, Chair, Vice Chair, members of the committee. I'm Caroline Kadirao with the Executive Office on Aging. We stand in strong support of Senate Bill 900 SD2 HD1 relating to the State Health Insurance Assistance Program, which is a program within the Executive Office on Aging. I just want to highlight some key points within our testimony. This is asking for 3 full-time equivalents for the program. Medicare is a very complex program to understand. SHIP provides free, local, unbiased counseling to Medicare beneficiaries through phone, email, in-person, statewide. Our Medicare beneficiaries have increased by over 300% in the last 30 years. This program's been in existence, but we still currently only have 2 full-time equivalents. Within our testimony, we show states of similar size that have smaller Medicare beneficiaries, but have larger staff to support them. We're currently roughly providing service to about 800 individuals, but we can do more with more FTEs for this program. And we stand in strong support as long as it doesn't reduce or replace priorities in the admin budget. Thank you. I'm available for questions.
Okay, thank you very much. Next is AARP on Zoom.
Good afternoon. I'm Audrey Suganakaga from AARP, and we stand our testimony in strong support. Thank you.
Okay, thank you very much. Next is Mei Fujii on Zoom.
Awakako. I stand on my written testimony and would like to share 2 experiences as a volunteer for SHIP, which blesses me with gratitude, appreciation, and ikigai, a term meaning living a life of purpose. I was surprised when a resident to Oahu came to a health fair, a new resident, to thank me in person for helping her on a Medicare question on the phone. After a friendly chat, she asked if she could give me a hug, which really touched me beyond words. On another counseling session, a gentleman expressed his dissatisfaction with Medicare, complaining, "Medicare has done nothing for me." After listening to him rant for a while, I offered information about options that he could pursue. Halfway through, his mood changed, and he said he would like to learn more about other plans. Before our call ended, he surprised me by saying, "I'm going to call the president to tell him to pay you volunteers for all that you do. This made me chuckle, silently, of course, that he would place a monetary value on our services that are absolutely free to everyone. We don't accept gifts or money, but we do appreciate expressions of thanks. And now I wish to acknowledge two very dedicated staff members, my staff of two, who are looking at me, and I see them sitting there wearing the same shirt with our logo. That's our uniform. And they not only educate, train, mentor, and support us, but they make being a volunteer a pleasure. They make it fun. And I warmly refer to them now as the wind beneath our sails. Your favorable consideration will greatly help to assist these two professional staff members that will keep our ship afloat and alive. Aloha kako and mahalo nui loa, Jaime Fuji.
Okay, thank you very much. Okay, is there anyone else wishing to testify on this measure? Okay, seeing none, members, any questions? Okay, seeing none, we're going to move on to the next bill, Senate Bill. Oh, you have a question. Oh, two questions.
Carolyn, what are the grades, grade levels that you need to really do a good job in providing advice? Is it above the, it's at least at the specialist 4 level, right?
Right, so our thoughts were program specialist 5, 4, and 3. The 3 would help to really help to triage the calls coming in.
Oh, I see.
And then helping the volunteers to make sure that those calls get out to the volunteers and managing the program.
Sure.
The 4 and the 5 would help program just expand.
But, I mean, the problem here is that you need people to actually do the work of giving advice, and the specialist 3 would unfortunately probably
So right now
not provide that service.
So we actually have a system in place. We have a contract for someone that actually does all the targeting and triage, but we'd like to, that's a costly expense to the program. A program specialist 3, we could train them in our targeting and triaging as the calls come in and get them to the advice of the counselors quicker.
Yeah, I mean, I would think that ideally you would drop the request for the specialist 3 and ask for a specialist 4 at least, or even a 5.
Oh, it does ask for 1 5,
Yeah.
1 4, and
Right.
1 3.
But you got one position that is, shall we say, subpar. Well, not wrong word. Okay, thank you.
Thank you.
Okay, thank you. Any further questions? Okay, thank you very much. We're going to move on to the next bill, Senate Bill 318 ST2 HD1, relating to fetal alcohol spectrum disorder. First up is Department of Health.
Chair of the department, stand on its testimony and support.
Okay, thank you very much. Next, State Council on Developmental Disabilities.
Thank you. Good afternoon, Chair, Vice Chair, members of the committee. My name is Annabelle Doherty, here on behalf of Hawaii State Council of Developmental Disabilities. We stand on written testimony, but would like to highlight the blank appropriation on page 7, line 14, which enables annual public awareness campaigns for FASD prevention. Our recommendation to fill in this blank is $35,000, calculated based on what our council spends on similar outreach events. Awareness is the most effective way to create systems change to support this gap group in our community, and this measure does a lot to move towards that. Thank you.
Okay, thank you very much. Next is FASD Action Group. Oh, she's here. Oh, please come forward.
Hi, good afternoon, Chair, Vice Chair, and members of the committee. Thank you for having me all over again. Hi, my name is Darlene Chen School, and I'm a volunteer advocate for this population. I have been working with this population for so many years, And the reason I have taken this task is because I've been working with children with autism for 8 years. I was an early childhood educator for 22 years. And it just struck me that these children has no services. I have done a research. I'm a doctoral candidate for CSU. In the last hearing I have attended, the Department of Health said it's 1 in 50 children has autism. But statistically, nationally, and internationally, it is coded as 1 in 20 first grader has it. The problem with this disability is that they look just like you and I. They do not have the facial or the behavioral feature of FASD that are visible, because they have the neurological damage in the brain. And they are mostly labeled as problem children in the classrooms, and they don't even know what's wrong with them. The thing about it is I have no mothers that will come forward to fight for their children, only because of the clouded stigma that I did this to my child. I have had an experience actually at the mental health task force meeting here held at the Capitol, when one of the women there come to me and said, "I'm one of your mothers. My period is not regular, and I did not know that I was pregnant until I was 4 months pregnant already. And my 10-year-old son have a lot of problems." And I said, "Join me. Fight for your child. Be a voice to your child." Which when my battle cry is the right diagnosis, right treatment, and right services for these children. And she said no, only because her family will come after her, her husband's family will come after her, and also the social circle that she belongs to. So I told her, I will be in your shoes to fight for your son when you cannot. And I understand that stigma that's clouded within this. And if you think about it, during the pandemic, 23% increase of drinking in isolation. We have 17,000 babies born in Hawaii, and that's 840 babies that has FASD. We have no data, we have no services here in Hawaii. The thing about it is, even globally and nationally, they're starting to acknowledge this is a problem, because this is an invisible disability that is preventable. And also, I would like to have a friendly request, if you guys can amend this to take an effect upon approval, because this is a critical issue. The pilot study for 3 years, this bill is originally just a task force, but the Senate felt that they have to do something. Senator Joyson Buenaventura said, "Well, I'm just gonna make it a pilot program so that we can do something about it," because I have been tirelessly advocating for this population for over 5 years. And I thank you for your time, and thank you for allowing me to testify for these children who has no voice. Thank you.
Thank you. Next is Robert Armstrong.
Good afternoon, Chairman Yamashita and Representative. I appreciate the opportunity to speak with you. I'll be very short because I know your day has been very long. I do stand on my testimony that I submitted, but I also want to approach this topic as the most junior member of the fetal alcohol syndrome disorder group, and as a member of the Chinatown Downtown Neighborhood Board. You know, in addition to the unborn and working with parents who are expecting children and working with childhood and educational age children on this issue, we also are dealing with adults here in my neighborhood, as well as yours, Representative Ward and Waikiki and others, where problems exist, and we don't know exactly why they exist, but they do, and they're becoming more problematic. And I can't help but think that a lot of the key to this, like understanding autism, is fetal alcohol syndrome and the impact it has on adults. And so I'd like you to think about that as you vote for this bill as it is. I'm very pleased with what has been drafted and happy to have it pass as is, because I think we're going to get to the core of homelessness, of unemployment, of crime in our community, the very things that you and I deal with all the time. And I thank you for your understanding and for your patience and for your consideration of this bill. Thank you.
Okay, thank you very much. Is there anyone else wishing to testify? Please come forward.
Angela Melody Young, testifying in strong support. So the purpose of this bill is to implement a pilot program. And the bill requires the Department of Health to implement the pilot program for the fetal alcohol spectrum disorder. So FASD are a group of conditions that can occur in a person who was exposed to alcohol before birth. These effects can include physical problems and problems with behavior and learning. Often a person with a fetal alcohol spectrum disorder has a mix of these problems. The behavior problems include a lack of coordination, trouble getting along with friends and relating to others, learning problems, and impulsiveness. So this bill sets the statutory parameters and policy guidelines for the pilot program. For the behavioral health providers and other healthcare providers to abide by. The doctor will monitor the patient's progress, and it will be recorded in the medical records in accordance to the plan. The disorder specialist shall review the patient's medical history, make any necessary modifications to the treatment plan with input from the treating doctor and behavioral health provider, and refer the patient back to the primary care provider. These are the guidelines set forth by the bill. However, it should be for consideration that there can be a little bit more statutory parameters for health interventions, because although it does discuss medication and providing periodic reports to the doctor, it doesn't go into the specific long-term support that may be medically necessary to provide as health interventions for those who are suffering from this condition. And if it's not outlined statutorily in the bill, then there will be kind of a difficulty accessing Medicaid and Medicare from the Social Security Act, unless it is outlined in the statutory parameters of the bill. So, yeah. So thank you for the opportunity to testify.
Great, thank you. Anyone else wishing to testify? Okay, members, questions? Representative Ward.
Thank you, Chair. Yes, yes, please. Your testimony was very interesting. The first question is, when does the onslaught of the fetal alcohol syndrome occur? I.e., how much do you drink? How much would a pregnant woman drink, and then boom, you've got it?
It's a very good question, Rep. But there's really no exact how much or how many drinks a woman would drink. It depends. But there's no precise amount that is noted of how it'll.
I mean, is that 1 beer, 2 beers, or 2 months worth of drinking beer, or is there any ranges at all?
There's no ranges. According to the study, there's really no ranges. It depends on the tolerance of a woman, and everybody is individual. So we do not know. That's unfounded. I am so sorry.
And this bill will help, hopefully, discern some of that.
Yes.
The other question is, it sounded in your testimony that we're not really sure sometimes if it's fetal alcohol syndrome or if it's Asperger's autism.
Okay, that's a very good question. Let me elaborate on that. The greatest thing about this is that autism and fetal alcohol spectrum disorder has a lot of overlaps on the behavior portion. The thing about it is when I was working for 8 years servicing children with autism under ABA guidelines, is that I see a lot of FASD children diagnosed with autism because they have services. Because I guess my theory is that I rather diagnose this child with autism because at least they're getting services than because FASD has none. And that's my greatest challenge. That's the main reason that I took this to heart to be a volunteer advocate, and taking many years fighting for this population because
So you're saying there's not tracers, neurological or biological? You say this is autism and this one is fetal
there
alcohol.
is. The autism population have the behavioral and facial. They have the visual of their disability. But the FASD looks like you and I.
Do
We
I
can
have it?
stand there. They can even pass. They can even pass the intelligence level as normal. That's part of the reason why the Disability Act Center do not have services for them. And I have collaborated with many clinicians. I collaborated with the Disability Act Center. Why are they not in your brochure when they are just as severe as autism?
Thank you for your testimony.
Thank
Appreciate
you.
it. Thank you, Chair.
Okay, thank you. Any further questions? Okay, thank you very much. We're going to move on to the next bill, Senate Bill 1594, SD2, HD1, related to crisis intervention. Okay, so first up is Department of Health, Behavioral Health Administration.
Hello, Chair, Vice Chair, and the committee. Thanks for having me. My name is Belinda Danielson. I'm the Community Program Supervisor for the Adult Mental Health Division Performance Information Evaluation Research Branch. I oversee the AMHD Crisis Services array, including contracted providers for our Hawaii Cares 988 and our Crisis Mobile Outreach Services. The department stands on its testimony in support of SB 1594 HD1. However, we originally submitted testimony yesterday, but after careful consideration, we revised our testimony to reflect an additional appropriation of $10 million for the Behavioral Health Crisis Center. So that was missing there. This amount includes startup and operational costs for the first year of operations. The rest of the original testimony is the same. Hard copies are provided of our revised testimony, and I'm available to answer any questions. Mahalo.
Okay, thank you. Is there anyone else wishing to testify on this measure? Okay, seeing none, members, questions? Okay, seeing none, we'll move on to the next measure. Senate Bill 1492, SD2, HD1, relating to mental health. First up is Department of Health, Behavioral Health Administration.
The department stands on its written testimony and support.
Thank you. Okay, next is Esther Smith.
I stand in support of this measure, although I do believe I know what they will find. What they will find is that we are desperately in need of psychiatrists and other health professionals in the mental health field. Very briefly, I recently had a patient who was very much suicidal, but I could not get her to go back into the emergency room because last time she was there, she was housed there for 3 days, never saw the psychiatrist, and was sent home. So she wasn't willing to go again. So instead, we started medications in our clinic, we did some counseling in our clinic, and we crossed our fingers over the weekend. She actually is doing much better and came back in and gave us a basket of vegetables, and she's smiling and laughing now. But it's not the same for everyone. So.
Okay, thank you very much. Is there anyone else wishing to testify on this measure? Okay, seeing none, members, any questions for the testifiers? Okay, seeing none, we're gonna move on to the next bill. Okay, Senate Bill 1370 SD1, relating to license solemnized marriages. Department of Health.
Good afternoon, Chair, Vice Chair, members of the committee. Lauren Kim, Planning and Policy Officer for DOH. Thank you very much. This is an administration proposal. This is a measure that started its journey several years ago with a lawsuit because the Department of Health was not authorized to issue a secular or civil license to solemnize marriages. With the help of the legislature, we got that on the books, but unfortunately, there was established a fee where none previously existed, and the plaintiff is asking us to address that for fear of another lawsuit. So we have made a proposal to establish it at $100 if for an annual license, and I think $25 for 2 months if you want to get married. And this is what we've seen, is people just want to get their best friend to perform the ceremony, and we think that's a very nice thing to do. So thank you for the opportunity to testify, and we kindly request that this bill move out of your committee.
Okay, thank you. Is there anyone else wishing to testify on this measure? Okay, seeing none, we're going to move on to the next bill, Senate Bill 384 SD1. Oh, sorry. Was there any questions, by the way? Okay, thank you. We're going to move on to the next bill, Senate Bill 384 SC1 HD2, relating to access for disabled persons.
Good afternoon, Chair.
Yeah.
First, with the Disability Communication Act, of course, we stand in strong support of this bill, and we just asked for the effective date to be changed to July 1st, 2023.
Okay, thank you very much.
Uh-huh.
Okay, thank you. Okay, State Council on Developmental Disability.
Thank you, Chair. We stand on our testimony in support.
Okay, thank you. Is there anyone else wishing to testify on this measure? Okay, seeing none. Members, any questions? Okay, seeing none, we're going to recess for decision making. We're in recess. Okay, the Committee on Finance will come to order. Okay, we're gonna reconvene for decision-making on our second agenda. First up is Senate Bill 1296, SD2, HD1. Recommendation is to pass it out as an HD2. We're gonna be blanking out the position and tech. Any discussion, members? Okay, Vice Chair for the vote.
Recommendation of the chair is to pass SB 1296 SD2 HD1 with amendments. Chair and Vice Chair vote aye. Representative Ayub.
Aye.
Representative Chun.
Aye.
Representative Cochran.
Aye.
Representative Garrett.
Aye.
Representative Kahaloa.
Aye.
Representative Kila.
Aye.
Representative Kobayashi.
Aye.
Representative Lamosal. Representative Morikawa. Representative Nishimoto. Representative Poi Poi. Representative Takenouchi. Representative Alcos. Representative Ward. Chair, your recommendation is adopted.
Okay, thank you, members. Waiting on Senate Bill 667, SD2, HD1, as is. Discussion.
Chair.
Yes.
You know, I've said so many times we should be the Hollywood of the Pacific. I just hope we can do much more of this for the sake of what now Georgia is still winning the place for where most movies are made. Then it's California, then it's New York.
Mm.
So I hope that the chair and others will just continue to
What
back
bill are you on?
this. Are we on the? Oh. You can see I feel
You
so
voted on
strong
that one
about it, I
already.
skipped. I was talking to my pharmacist outside.
Okay.
Sorry about that.
Okay. As is. Vice Chair for the vote.
Recommendation of the chair is to pass SB 667 SD2 HD1 as is, noting the presence of all members who will be noted present for the rest of this agenda. Are there any reservations? Any noes? Chair, your recommendation is adopted.
Okay, thank you. Voting on Senate Bill 795, SD2, HD1, as is. Discussion. Vice Chair.
Recommendation of the chair is to pass SB 795 SD2 HD1 as is. Are there any reservations? Any noes? Chair, your recommendation is adopted.
Okay, thank you very much. Now we're moving on to Senate Bill 1437, SD1, HD1. We're going to be moving this out as an HD2, and we're going to convert this bill back to the House position, which was House Bill 1362, and some technical amendments. Any discussion? Vice Chair.
Recommendation of the chair is to pass SB 1437 SD1 HD1 with amendments. Are there any reservations? Any noes? Chair, your recommendation is adopted.
Okay, thank you. Now we're on Senate Bill 1016, SD1, HD1, as is. Discussion. Vice Chair.
Recommendation of the chair is to pass SB 1016 SD1 HD1 as is. Are there any reservations? Any noes? Chair, your recommendation is adopted.
Okay, thank you. Moving to Senate Bill 62, SD2, HD1, as is. Discussion. Vice Chair.
Recommendation of the chair is to pass SB 62 SD2 HD1 as is. Are there any reservations? Any noes? Chair, your recommendation is adopted.
Okay, now moving on to Senate Bill 164, SD2, HD1, as is. Discussion. Vice Chair.
Recommendation of the chair is to pass SB 164 SD2 HD1 as is. Are there any reservations? Any noes? Chair, your recommendation is adopted.
Okay, thank you very much. Senate Bill 63, SD2, HD2. We're going to move this out as an HD3. We're going to be removing the A fund provision, blanking out the position, and tech. Any discussion? Okay, Vice Chair.
Recommendation of the chair is to pass SB 63 SD2 HD2 with amendments. Are there any reservations? Any noes? Chair, your recommendation is adopted.
Okay, thank you very much. Moving on to Senate Bill 674, SD1, HD1. As we're going to move this out as an HD2, we're going to be changing the means of financing to special fund and tech. Any discussion? Vice Chair.
Recommendation of the chair is to pass SB 674 SD1 HD1 with amendments. Are there any reservations? Any noes? Chair, your recommendation is adopted.
Okay, thank you very much. Moving on to Senate Bill 599, SD1, HD1. We're going to be moving this out as an HD2. We're going to be defecting it and tech. Any discussion? Vice Chair.
Recommendation of the chair is to pass SB 599 SD1 HD1 with amendments. Are there any reservations? Any noes? Chair, your recommendation is adopted.
Okay, moving on to Senate Bill 693, SD1, HD2. Recommendation is to move this out as is. Discussion.
I think we should go back to the proper way of doing it with the.
I agree. We'll keep it open for discussion. Any further discussion? Okay, Vice Chair.
Recommendation of the chair is to pass SB 693 SD1 HD2 as is. Are there any reservations? Any noes? Chair, your recommendation is adopted.
Thank you very much. Moving on to Senate Bill 759 SD2 HD1. We're going to move this out as an HD2. We're going to be blanking out the position and tech. Any discussion? Vice Chair.
Recommendation of the chair is to pass SB 759 SD2 HD1 with amendments. Are there any reservations? Any noes? Chair, your recommendation is adopted.
Okay, moving on to Senate Bill 900 SD2 HD1. We're going to move this out also as an HD2, blanking out the FTE and tech. Discussion. Vice Chair.
Recommendation of the chair is to pass SB 900 SD2 HD1 with amendments. Are there any reservations? Any noes? Chair, your recommendation is adopted.
Okay, thank you very much. Moving on to Senate Bill 318 SD2 HD1 as is. Discussion. Vice Chair.
Recommendation of the chair is to pass SB 318 SD2 HD1 as is. Are there any reservations? Any noes? Chair, your recommendation is adopted.
Okay, thank you. Moving to Senate Bill 1594 SD2 HD1 as is. Discussion. Vice Chair.
Recommendation of the chair is to pass SB 1594 SD2 HD1 as is. Are there any reservations? Any noes? Chair, your recommendation is adopted.
Okay, thank you very much. Senate Bill 1492 SD2 HD1. We're going to move this out as an HD2, blanking out the FTE and tech. Discussion. Vice Chair.
Recommendation of the chair is to pass SB 1492 SD2 HD1 with amendments. Are there any reservations? Any noes? Chair, your recommendation is adopted.
Okay, thank you. Moving to Senate Bill 1370 SD1, moving this out as an HD1. We're going to be defecting the effective date and tech. Any discussion? Vice Chair.
Recommendation of the chair is to pass SB 1370 SD1 with amendments. Are there any reservations? Any noes? Chair, your recommendation is adopted.
Okay, thank you very much. On the final bill, we're going to have Senate Bill 384 SD1 HD2 as is. Discussion. Vice Chair.
Recommendation of the chair is to pass SB 384 SD1 HD2 as is. Are there any reservations? Any noes? Chair, your recommendation is adopted.
Okay, thank you very much, everybody. We're adjourned.